Hello and welcome to your lecture. In this video, we're going to go over the muscles of the legs and pelvis. This will be part 4 of your muscle review. Remember that there are about 700 muscles in the body. We're going over a brief survey of about 50. When we're talking muscles and we're reviewing these structures on these PowerPoints or these pictures or from our lab manual or even from the models, I will be reiterating origins, insertions, and actions, and I'll be pointing out which of these muscles on our muscle list you can expect to see on your origin and insertion quiz. When we're going through muscles, there needs to be an understanding there are multiple layers of muscles. There are superficial and deep ones and intermediate or middle ones as well. So most of what we are looking at will be superficial muscles, but not all. There are some deep muscles that are thrown into our list. So we're going to get started here then on the leg and pelvis. And this will be the last video for you to prepare for your online muscle practical. Again, your online muscle practical will be 40 multiple choice questions identifying muscles from this list, and it's worth 20 points. So the first muscle that we have to address in the leg and pelvis is the rectus femoris muscle. This muscle is one that you're going to want to be aware of for your origin and insertion quiz. It has the action of extending the knee as well as flexing the thigh at the hip. It will originate on the anterior inferior iliac spine, or the AIIS, and will insert on the tibial tuberosity. So the rectus femoris, this is one of your quadricep muscles. I'm certain you've heard somebody reference your quadricep group or your quad. Hopefully the name quadricep tells you that there will be 4 parts to this muscle group, the rectus femoris being the largest, but one of the group. And you can see here on the picture pretty well, this is your anterior thigh muscle, the one on the front, the biggest one in the center. The next one in this group, we have vastus muscles of the quadricep group. There's a lateralis, intermedius, and medialis. The intermedius muscle isn't easy to see, so we won't see it on our picture, and it isn't on our list, but for your information, it is part of your quadricep group. We do have visible from the anterior aspect, the vastus lateralis and medialis. The vastus medialis will extend the knee. It originates on the femur and inserts on the tibial tuberosity. The vastus lateralis will extend the knee, originate on the femur, and insert on the tibial tuberosity as well. The next one on our list is the sartorius muscle. The sartorius muscle is one that you're going to want to understand the origin and insertion. The sartorius muscle has the action of flexing and rotating the thigh and leg. It will originate on the ilium and cross over the front of your thigh to the medial aspect of your knee and insert on the proximal tibia. This one is one that we have a verification that if you have a hip or pelvic issue, you're also going to have something a little deranged in the knee. The next muscle that we have to look at is the psoas muscle. In the iliopsoas group, you have the psoas major You're gonna have a psoas minor as well, but we don't have to worry about that one. And then we have the iliacus muscle that we have to look at as well. These guys are on the inside of the pelvic bowl, so they are very relevant when we see pain and dysfunction in the lower abdominal region and even in the lower back. But this guy specifically is one of the neatest muscles. The psoas muscle has the job of flexing the thigh at the hip, but it also laterally rotates the thigh and will flex the vertebral column. It will originate on the bodies and bases of the transverse processes of L1 through L5. And then it inserts on the lesser trochanter of the femur. So that's this one right here, the psoas major muscle. So it has its origins in the lumbar spine and then connects to the femur. So this guy can also hopefully lead you to understand that the connection between the lumbar spine and the actual hip joint is very real. The iliacus muscle lines this pelvic bowl. The iliacus has the job of flexing the thigh at the hip as well as laterally rotating it. It will originate on the iliac fossa and insert on the lesser trochanter as well. So similar in placement, a little bit different, but actions are similar as well. Now we have to look at our adductor muscle group when we get to the leg. So the first one we have to notice is the pectineus muscle. The pectineus muscle is one you'll have to be aware of for your origin and insertion quiz. It is this thick band right here. One of your groin muscles, sort of. It's the most lateral of those adductors. It has the job of flexing the hip and adducting the leg. It originates on the pubis and the pubic ramus and will insert from the lesser trochanter to the superior part of the linea aspera. So this guy kind of does a crossover. We can see it here connecting to our pubic bone. The next muscle that we have to look at in this group is the adductor longus. It has the job of adducting the thigh. It will originate on the pelvis and insert on the proximal femur. So this would be, if we're looking at the inner thigh, pectineus will be most lateral, then adductor longus, and then the next one in our lineup, which is the gracilis, the innermost inner thigh muscle. The gracilis muscle adducts the thigh and flexes the leg, originates on the pubis and the ischium, and will insert on the inferior to medial condyle of the tibia. So it goes the whole way down and crosses the knee. The next group we have to look at is the gluteal group. You do have a gluteus maximus, medius, and minimus. The minimus is not on our list, but it will be. The minimus is a more internal muscle, a deep muscle. The gluteus maximus extends the thigh, originates on the ilium, the sacrum, and the coccyx, and inserts on the gluteal tuberosity of the femur. The glute medius, this one you will have to know for your origin and insertion quiz. It will abduct and medially rotate the thigh. And it can do this because it will originate on the surface of the ilium, the outside of it, and will insert on the greater trochanter. The tensor fascia lata, or TFL. Your TFL, this is one you'll have to know for your origin and insertion quiz. It has the job of steadying the knee and the trunk and keeps the IT band taut. The IT band is the iliotibial band. It's a band of connective tissue that runs along the lateral length of your thigh. Look at the words iliotibial, from the ilium to the tibia. So the TFL is this little piece of muscle that will originate on the anterior iliac crest and insert on the anterior surface of the lateral condyle of the tibia. So another muscle that crosses the knee. Now we have to look at the back of the thigh. The back thigh muscles, this is your hamstring group. They're comprised of the biceps femoris. It's a biceps muscle, so that should give you the indicator that it has two heads, in this case, a long head and a short head. And it'll be the thickest muscle and the most lateral one that you'll be able to see, besides the IT band. The biceps femoris flexes the knee and extends the thigh because it originates on the ischial tuberosity and inserts on the fibula and lateral condyle of the tibia. Next, we have to look at the second muscle in the hamstring group, which is the semitendinosus and membranous, second and third, semitendinosus and membranosus. So let's do the tendinosus. The semitendinosus will be that middle muscle next to the biceps femoris. So it'll be more central. This one you'll have to know for your origin and insertion quiz. It extends the thigh and flexes the knee. It will originate on the ischial tuberosity and insert on the medial condyle of the tibia. When we get to the semimembranosus muscle, this guy has a couple parts of it that we'll be able to see posteriorly. The bulk of the muscle that we'll be able to observe will be more medial of the hamstring group muscles. It has the job of extending the thigh at the hip, flexing the knee, and rotating the leg medially. It can do this because it originates on the ischial tuberosity and inserts on the medial condyle of the tibia. We said it was a medial muscle, therefore it's going to likely insert medially, but not always, as we've seen some other muscles cross it, take a trip across a joint or across the side of the body. Now we're going to take a look at the calf muscles. Again, you have superficial and deep muscles here. The three that we're going to be considered primary for our purposes will be gastrocnemius, tibialis anterior, and the soleus. The gastrocnemius muscle will be the largest one that you'll be able to see, mostly from the posterior view. So we'll see another picture here shortly. The gastrocnemius muscle of your calf has the job of plantar flexing the foot and flexing the lower leg. It can do this because it originates on the condyles of the femur, both of them, and inserts on the calcaneus or the heel. The tibialis anterior muscle, which you can see from this view as well, from this side view, is going to be on the anterior surface of your thigh. This one you'll need to know for your origin and insertion quiz. This one has the job of dorsiflexing and inverting the foot. It can do this because it originates on the tibia proximally and then inserts on the first metatarsal and first cuneiform. So it goes down into the foot bones and one of the tarsal bones. The soleus muscle is the last one we have to know. It's going to lie anterior to the gastrocnemius muscle. The soleus muscle, we'll see a picture of this from the posterior aspect of the lower part of the leg, will be the muscle that can be seen like kind of fluffing around the gastroc muscle. This guy has the job of plantar flexing the foot, and it can do this because it originates on the tibia and the fibula at their proximal ends and also inserts on the calcaneus. Here's a really nice picture on a muscle. The gastrocnemius being the biggest calf muscle, the soleus being the supporting one that fluffs around it, and the tibialis anterior being the one on the anterior side. Here we have the posterior view. You can see the gastrocnemius with its two heads. And then the soleus muscle, more inferior, but peeking around the side from the posterior aspect. Okay, that's all we have for muscles, and good luck.